acquainted with and start using. And then you are going to have a test where you can do practice ahead of 1st of March, because we expected you to commence the use of the new platform effective 1st of March. So at the end of the training, you will receive the training for you to listen to over time, so that you get used to the application. And you are also going to be created upon submitting your user list. The audio recorded of this training. So if you have not done so, please do so. Like I said, you need to put your name, your job designation, that's what you are doing, your email address and your mobile phone number on the chat box as a mark of attendance. So I'm going to hand it over to Dr. Serrano now, who will run us through the how to capture utilization on the provider platform. So feel free to take note of your questions. At the end of the training, and ask your questions, or if you cannot ask, maybe your internet is bad, you can put your request on the chat box. Questions will not be answered on the chat box. Thank you very much. Dr. Serrano, over to you.
Okay, hello, good morning, everybody.
Good morning.
So I just want to quickly set up something. Just give me a few minutes. Yeah, so thank you very much, everybody. thank you very much, everybody. So the reason for this meeting is because based on the feedback from lots of you concerning the challenges we've been having and the operational difficulties. Let me call it the old ICT platform. We have decided to migrate from the old one to the new one. So that's why we've been doing this. You've been getting constant communication from me, stating exactly what you can do, how to do it, the kinds of information that we need from you. So I'll just do a quick overview of this. Then, as usual, last one, when we have completed a training series, we'll send the links to you, the videos we've made available on our YouTube channel, like when we did the last time, where the videos are available, such that to be constant reference. Then, of course, after this, we will also make available test platform for you to practice. So it's a case of practice makes perfect. So that's the plan for the scheme for you right now. So please send all your data as much as possible. Now, what I'll say is that anything that is entered into the old ICT platform is at your own risk. That's all I'll say. For the old ICT platform, anything you enter there is at your own risk. So I'll just do a quick overview and demonstration of what the new ICT platform looks like. So if you have any questions or comments, just post them in chat. So what I'll say is this: first things first, when you log into the platform link, we'll send you the link the same way we did the previous one. We'll also send you user manuals to make it easier for you to understand on how to use the ICT platform. So this is the ICT platform. It's still a web-based application that we're using. So the same way you logged into last one, but this one you use your email address and password. So what will happen is in using email address, please only use the email address for each particular person. So that means each staff in each hospital should have their own email address. It shouldn't be a case whereby medical records will use MD's email address, doctor will use MD's address. So each user should use their own email address. And if it's a hospital that has capacity to do it, the hospital can set up individual email addresses based on hospital's domain and all that, but that's much later thing. So for my own case, I'll just use an email address that I've created. Log in your username and password into the system, and then migrate and now open the system. Okay, so this is what you have in the dashboard. the system starts at an original dashboard. You can see everything here. Gives you a track record, what is submitted, how much is submitted, the value of transactions. So this was yesterday's people. So I want to quickly demonstrate something, how you can do it, such as verify patient. So the next step is you verify eligibility of the patients. Just a few seconds. Let's see. Yes, so you will observe. So what you have here in the release search engine is this. So now this is where the front desk officer is supposed to be dealing with and working with. The same way like in the old process, front desk officer will enter the details. You have the enrollee number, which you will then add here. You type the enrollee number and search. So you have enrollee number, surname, first name. But because we know that if you type a name like Ojo, you may find 1 million names. But if you type Serrano, you find probably 5 or so. So you click on search. When you click on search, so you have the enrollee number. So provision will be made for phone number. So you can see this. You have the family members, Ajibola, Tola, Ola, and Jeje that are there. Then based on the person that you want, you click on select. So now this is what you have. So you have the dashboard here. As per the details of the patient, you have the policy number, the employer, surname, age, and all those necessary things. Now I just need to make some clarification. This is a test environment. So membership status here, for any enrollee that is to be attended to, this membership status should read active. It should read active. So anybody's status that is not active, please disregard that person's situation. So it should read active. But this, because it's a test environment, that's why you're seeing pending there. So now if you scroll back, you can see the person's plan. Of course, for Lagos Health Scheme, we have only one plan. You can see the person's hospital. So if the person is in the wrong hospital, definitely you can make a claim there. So now, over here in this box that we're looking at here, you have the person's picture is supposed to appear there. So now when the person comes to facility, you can verify with the person's picture. But of course, aside from picture, the system needs to generate what we call a verification code. Now, this verification code is different from authorization code, so that it's verification code says that yes, this person is eligible and this person is in front of me right now to receive care. Authorization code speaks to what the person can do. So in the case of verification code, can the person enter the hospital, receive treatment? Authorization code, can the person receive this treatment? So now, in terms of verification, we are looking at two methodologies of verification. We are looking at verification via SMS directly to the enrollee, and we're also going to introduce a fingerprint verification, such that when the person comes and they scan the fingerprint machine, it's just there and then the system automatically verifies the person because of verification code. So now, first things first, you now put the person's number in this mobile section here. Put the person's number in this mobile section and just click on tick, then verify. Or you pick, if this is a record on file, verify. You now get a message. Oh, sorry. I've been using this patient a lot. So let me use another patient, sorry. Yes, so yeah, so you can see the verification code here. Now, the reason why I've seen this verification code here is because this is a test platform and we're using it for practicing purposes. With time, you won't see it here. It will be messaged directly to the person's phone. So in this case, I'm just copying the message. They now come to utilization. Once you receive verification code, the next thing you do is hit utilization. You enter the verification code that the person has given you and you press enter. So that verifies the person that yes, you can start treating the person legitimately. They now have updates, which is enter the parameters necessary for the patient. So you now have this screen. So you have vitals, benefits, diagnosis, utilization. Let's start with vitals. So now these are the vitals I can enter for the patient. These are the vitals I can enter for the patients. Of course, the nurses enter the vitals, height, weight, blood pressure, pulse, respiration rate, and co. They now save as appropriate. When you're done saving, this section called benefit utilization tells you what the person is entitled to and what the person has used and what the person has left at balance, which can help guide your decision in what you need to do. Diagnosis. So this way, enter diagnosis. Let's use case in point. Let's use malaria. So here you type malaria. It's still the same ICD-10 that we're using. Plasmodium malaria unspecified. Let's say the person's complaint is fever, body ache, and loss of appetite. Now save. Okay, so now add that. So let's get the next one you have. Let's try maternal. Let's try supervision. We have supervision of pregnancy, history of infertility first trimester. That's just an example. LMP. Please, my write-up is not a representation of what you should do. Please enter the right thing. So you can see it's captured here. So if you made a mistake and you want to correct it, and click on here and click on delete. That's DEL means delete. You can delete it. If you click on edit, you can correct the presenting complaint or correct the diagnosis. Now for utilization, you have consultation. So what we've done is instead of searching the entire thing, we've broken it into exactly what you may need to search based on the various categories. So if we look at consultation, let's look at specialist consultation. Everything here that I'm doing is just for example. It doesn't follow any rule or anything. So it's just for example, so we can all learn. So we have, let's say, under procedures. Let's say under procedure, we want to do this. We want this zero section for the person. Apply. Then you look at the last thing we want to do is, let's say, yes. Okay, let me try it. Yes. So okay, let's try appendectomy. Appendectomy, apply. Now, for this, all this, you can see all the things that are requested. They are all listed here. They are all listed here. So just disregard these errors. You can see specialist consultation, cesarean section, appendectomy. They're all listed here. Then you can make a request and send a request via PA code. Get a PA code. You can see request has been sent. So the system sends a request for all these items at once. Once you get an approval, you get a notification on this bell here telling that it has either been approved or denied. So now if you want to add additional comments, like history of presenting complaints when the doctor is clerking, let me just type anything here. So we simply save this. That is document, that's additional information. Now you have two options. You can choose to print it out now and keep it in your paper file, or you can save as draft and come back to it, or you can submit this single claim as a single claim, which is what you can do if you choose to do that. So, or if you want to submit everything as a batch, you can submit as a monthly claim. So you can see what I put here. This is it. So this is it. So you have this here. So you simply click here and submit the claim. So now once you submit like this, it goes straight to LSHMA. Oh, sorry, go straight to the HL, to the TPA, then from the TPA to LASHMA. So it goes to LASHMA. Sorry, don't submit. Yes, you can see that is gone. So now, if we look at it, if you want to track your claims that you're working with, you can see Claims Tracker. Come here, Claims Tracker. Sorry, the reason why you're seeing 4 is because I've had some other things that I've put for yesterday's training. You can see 4 here. Everything here. This is Claims Tracker. You can see it's awaiting vetting. It was submitted by me, vetted on this. That is available there. Then aside from that, you also have capitation and fee for service list. You click on it. You specify the period that you want. So instead of you waiting for me to send you the list, you can simply download it by yourself on the 1st of each month and make it available for your staff to use. So those are the things that you have on the system. So I'll just do a once over before we take questions. So first step, policy number, search, select the person, you can see the person, it should be active. If person is wrong hospital, system will not allow you to do that. You verify the claim. Oops. Okay, sorry, I've also abused this person already. So let me look for another person. So you can see, verify. It's already abused. So just give me a couple of seconds. Yes, so we now have the verification code. Click on verification code, copy, come to utilization, type the verification code here, which you get from the patient, enter, update. Hello. Okay. So as I said earlier, nursing process, enter it here, save, close that. Diagnosis, same ICD-10 we're all used to. Diagnosis, same ICD-10, you enter your details here. Utilization, everything that I've captured here will be populated here like that. Comments, questions, queries, you submit for any additional information. You can submit as a single claim or save and come back to it, and you can review your data over here. So I think that's, in summary, is what the new ICT platform is like. and definitely we'll do more training and more capacity building and more user manuals be available. So do we have any questions? If you have any questions, please kindly raise your hand up. Kindly raise your hand up so I can then call you to answer a question. So raise your hand up if you have any questions. Do we have any questions? Okay, let me check. Do we have any questions?
Yeah, yes, we do.
Ah, okay.
Yes.
What's your question?
Okay. My name is Benga from One Life Hospital.
Okay.
So my question is, the investigations, the scheme, does it cover all the investigation, like scan and every test? Does it cover? Because we've actually been having issues with that, the abdominal scan and all that.
Okay, so now we are changing ICT platform. We are not changing benefit package. Okay. It's only the ICT platform we are changing, not changing benefit package. So the same benefits that apply to the previous ICT platform are the same benefits that apply to this ICT platform.
Okay.
Yeah, so you can make reference to our operational guidelines and benefit package documents to get more details. This meeting is not for benefit package training.
Okay, sir.
The next question, Muka. Muka or Shodi Sadiq? Sorry, does anybody have any questions? Yes, ma'am. Dr. Peters, please go ahead.
Yeah, please.
Sorry, Dr. Peters.
Morning.
Can you say yes, good morning.
Hello. Can you hear me, Dr. Serrano? Yeah.
Yes, now we can hear you.
Good morning. Yeah, thank you so much for the presentation. My question is this. Now, under utilization, the drop down from the filter types, consultation, procedure, and all that. Does it mean that when they get to the pharmacy, under that utilization, there'll be a drop down for medication too?
Yes, there is.
Okay. All right.
It's the pharmacy.
So, okay. All right. Thank you very much. Okay, I can see now. Thank you very much.
Oyindamola, please speak. Oyindamola, please speak. Techno Canon 15, please speak. Life Fount Medical Center, please speak.
Hello, can you hear me?
Yes, who is speaking now?
Okay. Life Fount Medical Center.
Okay.
Can I go on?
Yes, please go ahead.
Okay, I really don't have a question. I believe that with subsequent practice, I believe that one will get used to the new ICT platform. Thank you very much.
Okay, thank you very much.
Or is it a presume? Is that presume?
Akinkumi Olukayode.
Yes, that's me.
Okay, finished. Okay. Oguntoye Samuel, kindly, if you're having technical issues, please send a message as text, as a chat. If you're unable to speak, please send your messages as chats. I'll read them from there.
Hello. Hello.
Yes, can you please speak up?
Okay. Hello, good morning.
Yes, good morning.
Yeah, good morning. This show from Making Specialist Hospital.
Okay. I'm listening.
I want to ask a question. My question is, can we just check in, if we check in an enrollee, like we check in, normally formal portal is when you check, you can still go back, even though you are not making use of the portal, you can check them in and later go back to it and fill in unnecessary document that's been done to the enrollee. Can we still do it on this portal, or we have, when they come in, we have to fill them in immediately?
The thing is this, if you don't get a verification quickly, the first step is to get a verification code. After you get a verification code, then you can move on and come and populate the other things later. But it's important that you get a verification code immediately. I have a question here. I have a question here from Live Found. Please, how do we access the portal?
Okay.
So the question is, how do we access the portal? So what happens is, as I said, so first things first, that's why we sent you a mail stating that you should send the details of all the users in your facilities. And we also created various classes of all the users in your facility. Now, if you look at my screen, I'll put it on a general group chat so everybody can see it. This is a test platform for the scheme on a provider portal. Very soon, we'll also make available, I'll also send it via email, the original platform that everybody is to use. So that will also be made available for everybody to use. So, do you have any more questions? Hello?
Hello.
Hello, yes, I can hear you.
Okay. Please, is it the only enrollee getting the authorization code, or the verification code? Is it the only enrollee that's getting it, or the provider is also going to get it? Because there may be a situation where the enrollee will tell us that, okay, it's not with his phone or whatever. So is it the only enrollee getting the verification code, or the provider too is also getting it?
So the enrollee will get it. Okay, so let me tell you why it is the enrollee that is getting it. We know some providers are creative. I'm not accusing LSHS providers of that, but we know some providers are creative, whereby a patient is in Ibadan and is getting the CS in Lagos. Those are some of the things that we're trying to prevent.
Okay. But but there always been a scenario that they may have already attended to the enrollee for the day. Maybe later in the day, the enrollee have already gone out of the station. So they are trying to pile up those things at the end of the day to start getting them filled up.
You must get a verification code. If you do not get a verification code, you cannot enter anything.
Okay.
Yes. So that's why I said verification code will be one via SMS, via email, and also we're also introducing fingerprint verification at the hospital level.
Okay.
Any other question? Okay, so somebody asked a question.
Thank you. No.
Somebody asked the question that, please, what is the, that's Akombi, what is the procedure for managing antenatal care on this new platform? It is the same way. Antenatal 1 for cases in first trimester, antenatal 2 for cases in second trimester, antenatal 3 for cases in third trimester. So it's still the same thing. So it is impossible for a woman to present to have antenatal 1 and antenatal 2 2 days apart. So it's still the same way that we're managing it. Any more questions? Hello. Any more questions? Please ask questions. Please ask questions.
Dr. Surania, please, are we still using the monthly list?
I don't want him to spend too much time.
So that's why I said I demonstrated that you can download your list by yourself on this new platform. You can download your list by yourself on this new platform.
Good morning, ma. This is Oladipo.
Okay, so I think, sorry, if you cannot hear you, just kindly post your question on your chat.
Okay. What's your name? Okay. You can't come by 4. Hello? I told you yesterday that if you can't come this Friday, it has to be next week Friday again. 4, the same time, 4 to 6 years.
She looks kind of different today.
So I have a question that says, can we turn down once? Can we turn down? Can it?
We're supposed to come on Wednesday.
Number in person. Which one of that out?
7-1, one there.
Okay, so we have some questions. Let me just address some of the questions here. We have, can we turn a patient down once he or she's status is not active? The answer to that question is yes for general public. For civil servants, please get in touch with Lashma before you do that. For the general public, please turn them down once their policies are not active. For civil servants, please get in touch with Lashma. Then you have another question that says, kindly ensure we get the recorded version of this practice. Yes, you'll get it. We'll post it on our YouTube channel and we'll email you the link for you to get it. So I think if there are there more questions, or we can wrap this up now.
Sir, you said that we should send a list of names of staff that we have now in our facility, but we've already done that in the first for the first quarter.
Okay, so let me explain to you. If you read my email well, I said kindly send a list of your staff for revalidation, because we know that not everybody in your hospital, when we're using the last portal, is still in your hospital as of today. Because I know for a fact that not every hospital sends us a list of people that have left the organization. So I said, send a list of your staff that is for revalidation, so we can remove everybody else that is no longer a staff in your organization. That's why we said send it. We have that information, but we want to be sure. So this aspect of revalidation, I can almost guarantee it will be an annual activity, so we can lock out and screen out users that are no longer using the system. So we rest assured, it's most likely an annual one.
It was you.
So any more questions?
Like it's not
Lady Lack, you asked the question, can we turn down patients once it's not active? I repeat, if the person's policy is not active, you can do that. However, if the person is a civil servant, please get in touch with Lashma.
I have a question, sir.
Okay, just hold on, please. Then the second question is, can we still submit claims immediately after treatment, or should we wait till the end of the month? Now, if you would observe, resume share. If you would observe, at the bottom of my screen, where is it? You can see submit single claim. So please don't wait till the end of the month. Submit immediately. So, Latent, your question.
Yeah. So my question, sir. So how soon should we expect the new platform?
How soon? We expected to start using the new platform 1st of March.
Yes. Okay, sir.
Anything that you enter into the old platform will be considered as charitable donation of mankind. So 1st of March.
Okay, sir. Thank you.
Okay, so it seems everybody, we don't have any more questions to address.
Okay.
So I think I want to thank everybody. Since there are no more questions, no queries, no posts, anything.
You're welcome, ma'am.
So we'd like to thank everybody and have a nice day. So please feel free to log out. Thank you very much.
There's a canopy outside there. You can have your seats there. Why they arrange the place you sit? You can't be standing. It will be stressful for you. I was just about calling you. Yes. I know you're coming. Sorry, That mama people.
So I need the recorded format to this training. Just
Hello, good morning. Good morning. This is Mara. The points that we are serious and go on. Pẹ̀lẹ́ o, mo rò pé wọ́n ti wà ní.
yes.
Yeah, what party? Party.
Do we want to submit it? You want to send it? Please, please, your own question.
Please, can we get the record of this?
For this.
Can we get the record for this? Oh, I but for this day. Or should I put what the table says?
Yes, you are listening. Yes, you are winning. Yes. Not this much. But they are all trying to fix it. That is like the examples and problem. When I went, that's what I was coming before.
Okay, I'll talk to her. Oh, that means you didn't see my card.
I did it now.
She was waiting on this one. No, I told her I'm waiting here.
Yeah, I told her I give her the card and say it's from now. So I thought maybe we go do something.
No, I don't know her. Okay, so I told her.
It's not that I need. Really,
It was somebody who said that.
okay, it's for your side.
No, this are for retired girls. So this is what I did.
Okay.
That is why I gave the card so that they can see who